Flu and COVID can most certainly cause very serious illness, especially in people who are not vaccinated. And therefore it's incumbent on us as healthcare workers to make sure that we do receive both the flu and the COVID vaccine. And I think it's really important that we demonstrate that and lead by example. And we've got a very active flu and COVID vaccination programme up and running in Ireland East in all of our 12 hospitals. And all of the hospitals have a flu and a COVID lead. And they have coordinated and scheduled a number of flu and COVID vaccine clinics in all of the hospitals. And they're going to be rolling out over the course of the next number of weeks.
It's been shown that immunity wanes over time. That's why it's very important to get your vaccine every year to boost your protection. Healthcare workers are 10 times more likely to pick up a flu and COVID infection. 60% of people spreading and carrying the infection may be totally asymptomatic. That is, we may not be aware of who is infected. So working in a hospital, it's very important that everybody receives their vaccinations.
Vaccination of healthcare workers has been shown to reduce influenza-related deaths by 40% in the population. And I think that in itself is proof that healthcare workers should vaccinate themselves.
I've had my flu vaccine here today, and I'm a healthcare worker, so I'm more at risk of developing flu and COVID-19, and I work in the maternity unit looking after high-risk women, pregnant ladies and newborn babies, so it's to protect myself and to protect them against flu.
It's so important that we encourage our health and care workers to get the flu and COVID-19 vaccine this winter. It's so important that they protect themselves but also other people around them.
The flu and COVID vaccines are a safe and effective way to protect yourself, your family and your vulnerable clients from the severe impacts that flu and COVID-19 can have. So just to point out that the flu and COVID vaccines are free from your HSE clinic, from your GP or your pharmacy, and they can be safely administered together.
Staff can avail of both vaccines at the same time, and we really recommend that they do. And I know some people have been a little bit concerned about getting two vaccines at the same time, but there's been a lot of information received in that the side effects are very limited or minimal. It's the same as if you get a flu vaccine. You might get a little bit of cold-like symptoms, but it's nothing to worry about. But yes, you can get both flu vaccines and the COVID vaccine at the same time.
So there's lots of peer vaccinators around, who are there to give you the right information. Speak to your line manager as well. And on hse.ie/flu, you can find the correct information about the flu vaccine as well. And you can always talk to people, about the actual vaccine. But this year we also have a HSE land module on the flu and COVID vaccine, so you can get the trusted information from the right sources.
As a healthcare worker, it's important that we are vaccinated to help protect the population of patients that we look after. And I think all staff being vaccinated will help reduce the risk of disease in our population.